Dr. Secord, we've heard
Yes.
about the fact that we're now in a position to test for this specific genetic mutation with the BRCA mutation. What exactly does this mean? And we hear now about the BRCA1 and the BRCA2. Is this mutation for both? What exactly does it mean?
Well, it's gotten so complicated, right, Diane? I mean, it's not just BRCA1 and BRCA2. There is a panel of a variety of different genes. It's probably up to at least 16 or 20 at this point. A lot of genes that have been implicated in carcinogenesis, so cancer causing. But I'll dial it back in terms of keeping it simple to BRCA1 and 2 for now. So some of the biggest words we hear about, well, you have an inherited mutation or you have an acquired mutation. So inherited mutation, what that really means is you have a germline mutation. You've inherited that from your parents. And that means that mutation's in every cell of your body, including the tumor. An acquired mutation, the other term for that is somatic mutation. And that means that that tumor has the mutation. It developed that mutation, but you don't have it in other parts of your body, and you didn't inherit it from one of your parents.
So we've heard that this test is available, and for the majority of people in the community, not much was known about this test. Many patients didn't even know that it was available. And then the story of Angelina Jolie with her mutation really took the media by storm. And for the few days around her diagnosis and subsequent surgeries, it was pretty much all that was talked about in the news, in the tabloids. She has done a huge amount for awareness, not just of preventative surgery, but sharing the emotions that went with losing her own mother to an inherited cancer and what it meant for her to be tested as a mom of 6 children. Talk a little bit about the awareness and how much that has helped women come to the medical profession and ask to be tested. How important has that been?
So it's so interesting that you raised that question, because for me, I'm so deep into it. I mean, this is my life. I'm so aware of the fact that there's these mutations out there, and I have been aware of that since the mid-1990s. So to realize how many people were unaware blew my mind, quite frankly. When Angelina Jolie came out and was so willing to share her personal experience, that was quite remarkable. And it was a huge benefit for women that she was willing to do that, because I think it took away the stigmatism about getting testing, and it also increased the awareness. And what it did for me too, at that junction, I didn't realize how unaware people were.
And I think it's also easy for people who see somebody like Angelina Jolie to think, well, of course she got all the testing because she's a multi-millionaire who has access to the best medical care and the best test, and there's no issues. It's extremely encouraging to hear from Diane that this test is covered on insurance. What about patients who don't have insurance? How expensive would it be for a woman to get this test done, or a man to get this test done if there's a family history, if they have to pay out of pocket? Is it feasible to pay out of pocket for these genetic tests?
It is feasible now. In the last couple of years, there are more and more labs that are offering genetic testing, and so costs are coming down. I would say the latest numbers we've heard is $200 to $400 to get genetic testing.
Which in the grand scheme of medical testing is not extortionate, is it? Some of these genetic tests can run into the thousands.
Right. And some of the labs offer programs where they offer financial aid and that type of situation. So, and the genetic counselor would be really apt to be able to help people navigate that system.
Now we're hearing about the association of genetic abnormalities, in particular with breast cancer and ovarian cancer, and also prostate cancer, for example. But it doesn't necessarily mean, correct me if I'm wrong, Dr. Secord, that if you are diagnosed with ovarian cancer, not everybody has an inherited risk that they're necessarily going to pass on to their daughters. Is that correct?
That's correct. The majority of ovarian cancers, they just happen. They're sporadic. They're not associated with the mutation. So if you were to take a group of women with high-grade serous ovarian cancer, like what Michelle had, and test them, about 14 to 15% will have a inherited mutation of BRCA1 or 2. And then another 6 or 7% or so will have one of those acquired mutations. But then there's that other group of mutations that's more rare, but we're learning more about. So as we move forward in the future, we'll learn more about these different mutations and how many really are inherited versus not.
And we've already heard that ovarian cancer is not as common as some other cancers. And if 10 to 14% of patients who get a cancer that's not that common to start with, who carry this genetic mutation, once you're testing positive for this genetic abnormality, what's the chance of getting the disease? How do you counsel patients who sit there having gone through genetic testing with a positive result, and they say, well, okay, what's my risk now? I am carrying this BRCA mutation.
Right. So Diane, you went through this personally, and actually so did you, right, with genetic counseling. But so for somebody who has a BRCA1 mutation, their lifetime risk is what they'll boil down to, can range anywhere from 40 to 60% for ovarian cancer. And if you have a BRCA2 mutation, it's about a 20%, well, actually even a little bit lower, maybe in the 16 to 18% range for ovarian cancer. So just because you have the gene doesn't mean you're going to develop the cancer. But those are pretty high percentages. When we dial down to, we talked about the general population, it's 1 in 70 women will get the disease. That's 1.4%. So now you're saying, okay, if I have this inherited gene, I have a 40 to 60% chance.
Right.
That's a 40 to 60 times, full change in that
And
risk.
we're going to come back in a few moments to talk about how you counsel women as to whether they should do surveillance alone or go the extra step and have preventative surgery.